question is how much vaccine should you use? Like with our animals, most of your veterinarians will give a full cc to a 200-pound dog and a full cc to a 5-pound Chihuahua. Guess what's happened? You talk about allergic reactions, and often people from a convenience standpoint want to come in and have multiple vaccines. That's even worse, and I think in kids too, I think you almost ought to separate it if you're going to do it.
So instead of just going in one trip and getting all the vaccines like in one trip.
Don't do that. That's an overdose, I think. And then the other end of the stick, if the kids or puppies do have my imbalance, one, they're not going to make literally protective antibodies. With the elevated adrenal estrogen, it binds thyroid, so the vaccine sits there. And the deregulated immune cells then overreact to it, and they hurt the patient. And so, yeah, I think...
Could that be like fatal death within a short period of time after having the vaccine in that situation?
I would think anything like that is possible, sure. You know, anywhere from a hive reaction to vomiting diarrhea to an anaphylaxis with elevated heart, the whole thing, bronchial constriction.
Is there certain types of vaccine that you think are better quality that, as you know,
for animals?
that you should ask for specific when you come in?
It's you know, that's a good question. It's hard to say. You know, often I think many times the vaccine depends on the cost of it. Whoever's ordering it, if they get it cheaper, you know, what's the big deal? And years ago, I noted in miniature poodles, many of them had allergies to chicken. They'd break out, itch, scratch, vomiting, diarrhea, and they also had reactions to the vaccines. And so I went back and researched the thing, and it turned out that all of the viruses were growing on egg embryos. So that was your common modality that was causing the food sensitivities. But they all have imbalances. To get a reaction, you normally have to have a hormone antibody imbalance. It's real easily measured. I don't know, I think the day will come when they'll start doing that, maybe even on infants before.
So is that what you're going to be checking? Like you're taking blood for Duke right now?
Right now, see if he's made antibodies.
Okay.
If he's made antibodies, there's a good chance he's perfectly normal.
Oh, okay. So what would, if you didn't see antibodies, then you would go to the next step.
Step 2 would be the hormone antibody test.
Okay.
Then we put him back on what he didn't come with orally, which is very simple, 2 simple hormones. And once he's normalized, then you vaccinate him, and the B cell that's responsible for making immunity will do so.
So when someone, you know, like for me, when I just started off, you know, becoming a puppy owner, you know, what kind of things do you think that, you know, that all puppy owners should be doing right off the bat? As soon as you get your puppy, what are the steps that you should be taking to protect your puppy and get all the shots? And
well, yeah, have your vet obviously check to make sure the puppy is normal. There's no abnormalities, heart's fine, everything's good. And then go ahead with the proper vaccination program. As far as housebreaking is concerned, stuff like this, normally it's easier to feed a puppy canned food in the beginning because there's less roughage and less stool. And you take food and water away from them after 6 o'clock at night. And they don't drink and potty. And you don't trust them till they can. And often if you're in a home or a place where you can put out a pamper or a pee pad or something like that and get them to go on it, then you can put it out in the yard even in a small box, and they will go to it. That way you're not all over the yard picking up stool and everything else. A lot of the flea medications, the spot-on type stuff, are highly dangerous, period.
Because aren't they like neurotoxins? They're actually pesticides?
Well, they're pesticides, sure. They can knock out the adrenals, they can knock out a whole bunch of things, just like mercury can. The Confortis seems to be...
Hey, Duke!
There's Big Boy. Hey, Duke.
You guys will have the results in about 1 to 2 business days, okay?
And I'll call you when we get them, just to let you know what's cooking.
Hey, Duke!
Because this is something, too, in your area, because I consult all over the world, and in your area, if you have somebody that's interested or a vet you like, I can work through them to save you the long trip in. And I do this all the time.
Well, I wanted me to.
We come all this way all the time anyway for business, so we can always coordinate.
And you know something.
And then why don't you, like I've been giving Duke the minerals, the Nutrimin,
Really
and
important.
and why don't you? Can you explain like the benefits to using those minerals in your dog's food?
Yeah, it should be. It's a calcium monoaminoate that I actually researched 30 years ago, and actually wrote articles on, I think, in Pet Age in 1985 November. And what it is, one, you can eat better, but you can't eat healthy. And the reason for that is the soils have been overworked agriculturally. One, and so with so many of the enzymatic reactions that are so important that take micronutrients in the body, without it, you end up with micronutrient deficient diseases, which really haven't been looked at. And so using the Nutrimin, it's chelated, and even in a big dog where everybody's afraid of using calcium because they'll grow too quickly, the chelated calcium, meaning the body won't pick it up unless the body needs it, it funds the calcium base for whatever animal, plus the trace minerals, and the bodies won't pick it up if they don't need it. The other end of the stick that I think is even becoming more important now is the fact that the foods are, people food and animal foods are coming through with heavy metals. And what the negative ion in this calcium monoaminoate does is it'll literally chelate out heavy metals. It binds toxins. It also neutralizes pathogens. For MRSA, your resistant staph bacteria, it literally, by doing a poultice on the area, it'll stop the bacteria cold because it changes the pH in the environment. It's interesting, we sent letters. I did do an article that went to, I believe, Fukushima, and they're using calcium monoaminoate in their cement to cover up their nuclear reactors. And this is what Chernobyl did. So nobody realized. They used the French green clay to tie up. And this product, particularly this calcium monoaminoate that I've researched, literally comes off the top of the Colorado mountains into the river, into basically ends up much of it in the San Andreas Fault. And when it comes out, it's been exposed to 880 degrees. And this is where it gets a very strong negative ion. And so it's been outrageous. It has, and Mother Nature did this.
I just think it's thought most awesome thing that we have this source available to us. I just think it's so grateful.
I had about a diverticulitis, and then I started taking those clays. I never had any
that kale
problems anymore.
That chelated kaolin takes care of it. It really does. Also, it's interesting. In a number of animals too, parasites live in an intestinal pH of 6 to 6.5. And one of the interesting things is that what this calcium monoaminoate does, it has a pH of 8.3, and in that many intestinal parasites can't live. So there are a number of reports where, for coccidiosis, other things, that the animals shed it. They no longer have the problem.
What about for like worms?
Well, that's what we're talking about.
Oh, okay.
We're talking about intestinal parasites, worms.
Yeah, because that was one of the things I was wondering about for Duke, on whether, should I be worried about like heartworms and things like that? Is there some sort of pills I should be giving them for
Well, no, what you do with a heartworm, and we haven't been, at least in this area, we really haven't been seeing much.
Oh, okay.
You see it in the southwest, you see it east, midwest, and what you do before you do anything, you do a blood test on them to make sure there are no microfilariae larvae where they've been already exposed. But we're really not seeing that here.
But you're saying by giving them the minerals, the calcium monoaminoate, that's actually
intestinal, but not your heartworm.
Oh, okay.
Your heartworm is a circulatory thing in your pulmonary circulation.
Oh, okay, so it stays in your bloodstream and makes its way into your heart from there.
Right. Well, what happens is the mosquitoes bite them.
Oh.
And they transfer the microfilaria, and the microfilaria then turn into heartworms. And so that's why you check them first, because if they've been exposed and they have microfilaria, and you put them on some kind of a heartworm medication to kill the heartworm, you can literally kill the patient. So you got to be real careful, and that's why you see some of the stuff being sold over the counter.
This is your good doctor.
And you're saying that don't even buy anything over the counter. Your dog needs to be tested first.
You check first. Absolutely. Okay. And as far as flea stuff goes, it's interesting. Over the years, I've used for my patients
me my newfound hippie side. Once ignored these conspiracies online. Out the window, visions of the earth. Sign me up now, make sure you use your smart. Take a walk on the wild side. Will the birds and the bees survive? Would your children like to see Mother Nature sigh?
Be sure to visit our website at smarthealthtalk.com.